To introduce myself, I am Dr. S. Ramakrishnan, Senior Rheumatologist, Apollo Hospitals, Chennai. Today is World Arthritis Day, a day which is dedicated to people who suffer from arthritis throughout the world. You can ask me a question, what is arthritis? Arthritis means there is a basic problem in the joint. When the joints get swollen, they are warm, and people may have difficulty in even moving the joint. Now, this particular arthritic conditions, when left untreated, can result in deformities, resulting in incapacitation and ultimately interfering with activities of daily living. Arthritis is also seen in children. There was a myth that arthritis was only seen in the elderly, but it is often seen in children. The commonest type of arthritis, which we see in children in this country, is a condition called rheumatic fever. In this particular situation, people develop a sore throat associated with fever, with ultimately pain and swelling in the joints, which migrates from one joint to another. But the greatest misfortune associated with rheumatic fever is that rheumatic fever licks the joint and bites the heart. A majority of these children, their heart valves get affected, which may even necessitate surgical intervention. So whenever a child develops sore throat associated with fever, with a migratory arthritis, you have to seek medical attention immediately. There is a second condition which we call as juvenile arthritis, in which the joint swelling will persist for more than 6 weeks. If any child has arthritis lasting for more than 6 weeks, it is absolutely essential that they seek medical attention, because this arthritis, when left untreated, can go in for joint deformity. Unfortunately, in juvenile arthritis, a minority of patients can have affection in the eye. When the eyes get affected, then these people can even land up with blindness. So one important thing is a condition called juvenile arthritis, which is also seen in boys as well as in girls. Sometimes juvenile arthritis can present as prolonged fever. It can present with swelling of the lymph nodes. It can present with enlargement of the liver, enlargement of the spleen. It can also be associated with rash. Now, how do you treat juvenile arthritis? Basically, there is a process of inflammation which is responsible for the pain and swelling. We treat them with painkillers called non-steroidal anti-inflammatory agents. Basically, there is a disease process in juvenile arthritis which is managed by medications called disease-modifying anti-rheumatic drugs. Now, these drugs are capable of modifying the disease process, but they have to be given for a prolonged period of time, and when they are given to children, they can result in side effects. So people require regular monitoring of blood tests, and they also have to see a rheumatologist periodically at least once in 3 months. One important message which I would like to give to parents who have children with juvenile arthritis is you have to be empathetic to them, and you also have to take them through a regular physiotherapy program. That is absolutely essential. And being a disease which requires prolonged treatment, you have to see to it that they go through an exercise program and they do not get into any self-medication. Majority of patients do follow the doctor's instructions, but sometimes the parents take the law into the hands and they discontinue the medication, or they go in for self-medication. This should be totally avoided in children with arthritis. So as far as children are concerned, they can even develop arthritis. It is an absolute myth that only adults develop arthritis. You have rheumatic fever, which can lick the joint and bite the heart. And then you have another condition which is called juvenile arthritis, which can persist in the joint for more than 6 weeks and ultimately result in joint deformity. Juvenile arthritis, you pick it up early, diagnose early, treat early, the children become absolutely fine. Arthritis can also occur in adults. The commonest type of arthritis which we see in adults is a condition called rheumatoid arthritis, which is more common in women than men. Usually it affects people between the age of 20 to 40 years of age. How will patients with rheumatoid arthritis present? They present with pain and swelling of the smaller joints of the fingers, of the wrist, of the elbows, the wrist, the knees, as well as the smaller joints of the toes and the ankle. Patients with rheumatoid have early morning joint stiffness, with the result they wouldn't be able to make a fist in the morning. The cause for rheumatoid arthritis is still not clear, but it is the situation when the body's defense system starts fighting the joint. Rheumatoid arthritis is something which has to be diagnosed as early as possible and treated as aggressively as possible so that the patients do not land up with deformities and does not interfere with their activities of daily living. Laboratory tests are available to make a diagnosis of rheumatoid arthritis, and the treatment as set for juvenile arthritis will be the administration of painkillers, which we call non-steroidal anti-inflammatory drugs, and on the other side you have disease-modifying anti-rheumatic drugs available in this country. As far as India is concerned, all modalities of treatment are available in India, comparable to any other treatment offered in any other part of the world. We also have a darling drug for the rheumatologist, which we call as biologics, which are capable of altering the disease process, and biologics are also available in India, and you have to consult a rheumatologist who will ultimately decide whether you have to take a disease modifying drug like methotrexate or whether you have to get into some other biologic. Physiotherapy forms the sheet anchor in the treatment of all rheumatological problems. Regular exercise program, walking is very essential. In addition to that, stress has got a lot of role to play in the causation of arthritis. So patients with arthritis are quite depressed that they're not able to do the activities of daily living. They can get into yoga, meditation, and reading self-help books and listening to soulful music. The relatives of patients with arthritis should be absolutely empathetic to the patients with arthritis, and they have to be very, very kind, courteous to them, because psychosocial support is very, very important. Last but not the least, you could ask me, what is the specific diet for patients with arthritis? There is no specific diet. They have to take a well-balanced diet to maintain a normal body weight. The other condition which we see in arthritis is gout, a condition in which the uric acid gets elevated in the blood. One fine morning, the patient will get up with painful swelling of the big toe, and that's called gouty arthritis. This occurs more in males than females. The treatment of gouty arthritis is medications to decrease the uric acid, and they require long-term treatment. About arthritis, whether arthritis is curable or not is an important question. Majority are controllable, minority are curable, but one important fact is you have to consult a rheumatologist at any point of time if you develop swelling in the joint, pain in the joint, warmth in the joint, deformities in the joint. Early diagnosis and early treatment will see to it that they are absolutely fine as possible. Life is mobility. Mobility is life. The joints give us mobility. So what I would tell to the public is, when you have warning signs of arthritis, it is best for you to consult a rheumatologist so that you get ferried from the miserable islands of illness to the blissful meadows of good health and happiness.